You know, I don't want it to be based on luck. I want it to be based on we have a system of care where people actually get what they need. And we don't have that right now. So,
in my opinion, access to consistent long-term mental health care is out of reach for 95% of the Colorado citizens in need. Of course, I'm just making up the numbers, but I know from personal experience that people are confused, frustrated, and lost because there is no system.
Even the now defunct Arapahoe House didn't have the appropriate support for schizophrenia. The only program in the state that meets his needs for long-term psychiatric and substance abuse treatment and takes his insurance is the 90-Day Circle program in Pueblo, which has a 2-month waiting list and a lengthy application process. If he gets into the Circle program, then what? He needs a now non-existent dual-diagnosed residential assisted living group home with a social component.
if you look at the workforce that does this kind of work, from 2008 till now, it's decreased 14%. So we're not going to be able to meet the need with our old kind of ways of doing things. We've got to think about how can we scale things, how can we be more flexible, how can we use technology in a way that gets people what they need. Wouldn't it be great if we had digital access to any kind of service that you needed? Right now in Denver, you can go to Claremont and Colfax if you know about it, and go to our walk-in clinic that's open 24/7. But if you don't know about it, you don't know what to do. So we've got to make access easier.
I finally got a hold of somebody who says, hang up right now, call your insurance company and take him off your insurance and tell Centennial Peaks he has no insurance coverage. That forced Centennial Peaks to actually call the county, which then allowed him to go to JCMH, which led to Fort Logan, which gave him a 6-month period of time on a stable program where he could see that life could be different if he could stay on the meds for long enough.
He almost didn't get treatment because he had a pending criminal case in Missouri. And because when they asked him during the intake if he had any pending criminal cases and what the situation was, and he told them because he had a felony possession in Missouri from when he was illegally using drugs, which is what happens when you are addicted to illegal drugs. But that's not why he was here. He wasn't there on court-ordered medication. He wasn't there on court-ordered treatment. He was there because this was one of the things that happened to him that almost killed him. And they told me that they weren't going to accept him. They weren't going to accept his Medicaid because it was...
One other thing, which is racism is a big issue in this whole field too. And if we don't address that as we go forward, we're going to see disparities that continue to happen. There's lots of implicit bias that happens and where people land in our whole system if we don't do something to address that.
So the other thing that worked for him was being a white, upstanding looking guy where he called the judge and they were like, oh, it's fine, don't worry about it. And vacated his entire felony.
What is going to happen to him when we are older citizens than we are now, and we die? He will end up in jail or on the streets is our big fear. He has no one else but us right now, and deserves so much more. He is not a statistic or a diagnosis to us.
He's a good person with a brain dysfunction who needs help, like so many who are mentally ill and homeless or getting mental health treatment in jail, which is not as cost effective as what our son needs. That isn't there yet.
We're completely adrift for 2 years when he became an emancipated adult, and all of you know what that means. Any pretense of an organized mental health care system was ripped away once my son reached the age of 18. Only at this point we experienced the complete indifference and famously callous brick wall of I can neither confirm nor deny someone by that name is in our facility. After we personally helped him get admitted to the facility.
This week alone, I've talked to a caseworker from Highlands, Department of Social Services, Long-Term Care, Adult Protective Services, the Department of Public Health and Environment to try to get any records I can, 2 facilities in Denver, Health Solutions in Pueblo, and a new facility in Colorado Springs, just to try to get him out of a mental health hold and into a location. Wouldn't it be nice if I had a single person I could be working with through this time of crisis? I would end by saying, what if we stopped talking about making a difference and we rallied to make a difference? What if Colorado had enough beds? Sorry, it's been a rough couple weeks. What if family could actually help? What if Paul Federico Jimenez was your uncle, or your son, or your father? Thank you.